If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. As you know, this is our 15th season, and this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we're here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, you can call the live phone line at 718-499-6101, and second, you can email us at askthedoctor@netny.net, and we'll bring your questions into a discussion. And only for this season is the Net Viewer Survey. If you haven't done so, please take the time to participate as you wait for your turn to go on the air. Now, this survey is here because we'd like to give you a chance to officially and anonymously sound off your opinions about Ask the Doctor and net programming in general. Now, for those who could not get through and are not on our mailing list, please write to NET, and the address is 1712 10th Avenue, Brooklyn, New York, 11215, and ask for the survey to be mailed to you. And of course, you can participate online at netny.net. I thank you for your help in this. Now, for this episode, we have a stellar panel, as I always say, but this time I really mean it now. Now, here we have Dr. Edmund Gigerich, the Chief of Endocrinology at the New York Methodist Hospital. We have Dr. Reginald Manning, Orthopedic Medicine attending at the New York Methodist Hospital, and Dr. Gerard Lombardo, the Chief Medical Officer at United Sleep Diagnostics. Welcome to everybody. In the news, new guidelines, this is very important for new mothers and fathers, new guidelines for sleep and babies and how to prevent SIDS. Here are the suggestions. Sleep in the same room as the parents. And it's interesting, they don't want you to sleep in the same bed, but they want you to have the baby in the room so you can hear if there's any problems going on. The bumpers, that should be thrown out. The bumpers you put around the crib, they found they didn't help prevent any accidents and they could cause suffocation. So get those bumpers out of the cribs. Breastfeeding reduces SIDS, so that's good. If you can breastfeed, try and do that. Babies should be sleeping on their back, so you just put them on the back in the crib. And what should be in that crib? Nothing. Now, if you keep any kind of toys in there, these become suffocation risks. So that's about SIDS. Now, another thing is, don't use the drop side cribs. You know those things where you drop it down? That was causing a lot of injuries. They've been outlawed now, basically. But some of the old cribs, if you go to buy a crib used, you may still have it. So don't buy the ones where the front of it or the side comes down. Now, the deaths from SIDS have been decreasing, but the numbers of suffocation have been increasing. So you got to be really careful about this whole thing. Bariatric surgery, you lose the weight, you get home, and it has an unexpected consequence. Your family begins to lose weight. For whatever reason, it seems to be a powerful motivator for decreasing in eating. So a lot of and they also drink less alcohol. So having the family member lose weight is a powerful dietary modification reinforcer. So it's interesting. I think it would probably work even without bariatric. If somebody loses weight, it's going to encourage others in the family.
Sure.
Now, another important story, we know that ulcers are caused by bacteria in many cases. It was kind of interesting. Now we find that the same bacteria found in the plaque in the gums or in the appendix when you have appendicitis is found in cancer of the colon. And what this means, we're not quite sure, but it could mean that there may be a way to prevent colon cancer by treating with antibiotics. Or it could mean that the two just are associated for no apparent reason, but there's a definite association between colon cancer and bacteria. So I think we're going to be a lot more. Two stories came out today, published in different journals on the same topic. So one out of Harvard, I don't remember the other one. Number 4 that I wanted to talk about, this is Breast Awareness Month. Two things I wanted to bring out. One, positive breast cancer, false positives. When the doctor recommends a breast biopsy, only about 85% of those cases will be negative for cancer. So that means that there's a good chance it's going to be negative, but the doctor wants to get some additional follow-up for whatever reason. So women should keep this in mind and not panic when a biopsy is called for. The other thing, a study came out showing the prevalence of breast cancer in men is increasing and more deadly. And it's interesting, we talk about Breast Cancer Awareness Month. You very rarely hear about men and breast cancer, but it's much more aggressive. Men are embarrassed, they don't go to the doctor. But when they feel a lump or there's an abnormal dimpling in the nipple or any kind of discharge or redness on the breast, it's time to go in and get a mammogram, just as the woman would. And the earlier you go, the better the chance. It found it was just so much more deadly in men because they put off getting it until it is spread all over the body. Anyway, Monsignor, it's great to see you here tonight. Hasn't missed a show. I missed one show, actually. Missed one show. But we have a, wait till you hear the quiz, Monsignor. You're going to like this. I want to shout out also to Philomena, who came over in Barnes & Noble yesterday to say how much she liked the show. She's been watching for a long time, so I want to welcome and say hello to you. And now this quiz, so get your pencils ready. What TV teacher is the only person to have won an Emmy for a religious program? What TV teacher is the only person to have won an Emmy for a religious program? What do you think, Monsignor? Monsignor thinks he has the answer, but we'll wait and see. But give us a chance here. Now, we're going to take a break, but I want to remind you, tonight's topics are endocrinology, orthopedic medicine, and sleep medicine. The number to call is 718-499-6101. You can also email us your questions to askthedoctor@netny.net. And please take the survey. It helps to keep us on the air. Actually, they're doing like a little Nielsen rating, and they want to see how people answer the survey, what shows they like, which shows should be kept on the air, and which shows, you know, maybe should take a hike and go to another station. So we don't want it to be Ask the Doctor. So take the survey, okay? So don't go too far, because we're going to be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are endocrinology, orthopedic medicine, and sleep medicine. Let's meet the doctors, though. And we have someone new to our show. It's an oddity now, rarity, Dr. Gigerich, right?
Absolutely.
And
Yes.
You're no stranger, though, to Brooklyn, are you?
No, I've been, all my years of practice have been in Brooklyn. So I started in Brooklyn in 1982, and I've...
Did you grow up in Brooklyn?
No, I didn't grow up in Brooklyn. Went to medical school in Brooklyn. I grew up on Long Island.
Oh, nice. Did you ever live in Queens or no?
That's where I live. I live in Queens.
Because we have a big audience out there in Queens. Glad to see you on the show. Endocrinology, just for those, big word, what does that mean? What are the key things you see?
It's the study of hormones. So we see mostly people with diabetes, thyroid problems, and other more unusual glandular disorders.
You're going to get a lot of calls because we always get diabetes, thyroid disease, so it's great to have you here.
Great to be here.
The family lives there, the whole family?
Absolutely. I have a daughter who's 30 years old, a teacher in the New York City school system, and a wife who's a psychiatrist.
Really?
Yeah. Makes the arguments a little bit more interesting.
We'll have her on the show soon.
Okay, sure.
Very nice. Good to have you on board.
Nice to be here.
What's going on, Reggie? Anything new? I mean, the Yanks got blown out there in the first round.
Yeah, don't make me cry.
Yeah, I don't know what happened.
Well, they're getting older. They didn't have any pitching, and they couldn't get one hit with bases loaded twice.
The clutch,
less than 2 outs.
You're talking about the clutch A-Rod.
Oh, I wouldn't call him that, but...
Yeah. So what's the? I understand that your daughter's doing us all proud. Yeah.
Yeah, she works for the Guardian Insurance Company, has a good high-level job there, and she's doing quite well.
And the Nick tickets come with the job?
No, those are her own.
Wow. Oh, she just has those?
Yeah.
That's amazing. And she lives in
Knicks
an
fan.
historic, I mean, I love that Turner Towers, right? That's really got a lot of class to it, an old-time building. I don't know if any of you out there know on Eastern Parkway, a magnificent building. And,
Absolutely.
I'm glad that it's still in good shape.
She'd make sure, trust me.
Excellent, excellent. So it's great to have you. The audience always loves that. We always get flooded with orthopedic calls when Dr. Manning's here.
Good to be back.
Great to see you. Dr. Lombardo, who we had so many calls last week, I had to tell him call back this week about sleep disorder.
I'm ready.
Is it seasonal? Do you notice problems different times of the year?
Well, there's a seasonal aspect during winter where a little bit of depression related to the dark, that can affect the sleep cycle. But sleep is an all-year phenomena, so we see problems.
And I know your first book, I know we showed that book a lot. Another book may be coming on its way.
In the works, yeah. I'm competing with my wife. She's just finished her third book.
Tell me about your wife. I always like to
She's doing well. Just new show she's working on, and the third book she's a cookbook chef.
Which show can we? What's the time of the show and the channel?
It's Cooking Channel. and it's Viva Daisy. That's the name.
Viva Daisy. So out there, you know, it's a great family. Yeah.
Thank
And
you.
he's also an administrator now. He runs. He's the vice president of the medical organization.
It's of our at Methodist Hospital,
Yes.
the medical board. Yeah.
And what I like is that, you know, in today's time and day, it's very important not only to practice good medicine, but to practice it with the right economy. You need to do that, otherwise the hospital's closed. And it's something I always admire, that you always stress at the meetings, that the two don't have to be, they go hand in hand, basically. They're not dissimilar.
Quality first, always, taking good care of people, and then watching the dollar, which is something we all need to do.
So anyway, we've introduced people. I don't want to take too long because we're watching our dollar. We got to get these commercials in here, but we're going to go first. Let's see, who's our first caller? Could it be Maddie? Could it be Grace? Could it be Joel? Hello?
Hello, Dr. Bonner.
Who is this?
It's Pat. How you doing?
Pat, hi. You're the first caller of the night.
I've been waiting all week to call you. How's everything?
Everything's good. We had a good week. How you been feeling?
Good, pretty good. I still got the dizziness, Doc. Got that pain in the back of my neck. I can't get rid of it.
Pat's been having dizzy spells that even lead to almost like panic attacks, and now he's getting pain in his neck. Anybody want to weigh in on this?
Sure. Tell me about the pain.
It's right in the bottom of my neck, and I'm always getting lightheaded when I walk.
Anything tend to aggravate the pain? Positions, activities?
Well, I had told Dr. Ronald last week, when I lay straight down, I get the room starts to spin. You know?
Well, neck pain by itself shouldn't cause you dizziness. That suggests a central nervous system problem. Maybe you might need to see a neurologist about your dizziness.
And he's had a little, anxiety problems and so on. But it waxes and wanes. So Patrick,
Yes.
do you have any? I know you won the quiz a couple of weeks ago. You almost won it last week with the livestock answer. How about this week? Do you have an answer?
Well, I don't have the question.
The question was, what TV teacher was the first winner of an Emmy Award for a religious show? Okay. Anyway.
I'm going to guess Dr. Carter. Mr. Carter?
Mr. Carter from Welcome Back, Carter?
Yeah.
Is it Mr. Carter from Welcome Back, Carter? No, I think the part that I gave it away was the religious, but anyway. Pat, I know about this shirt. You haven't received your shirt yet, have you?
No. And Doc, I want to just say, I'm up. My buddy had twins.
Oh,
very, very nice story. His brother gave him a kidney last year, and he wound up having twins. I'm holding the babies as I'm talking, and Nadine and Natalie.
Oh, it's great, great. So they're going to be Brooklynites, huh?
Yeah, we're going to say hello. Give them a big hello, Doc.
Anyway, Patrick, so your shirt will be shipped out this week.
Hey, Doc, a horse is livestock. I should have won last week, too.
Yeah, no, we were looking for horse. But
I don't know, Doc. That's a little...
very close. I go by the...
One more thing. Happy birthday to Big Vinny.
You did it. Take care.
Thanks.
Now we're going to go to Naomi. Hi, Naomi. Naomi? Naomi?
Yes.
How are you? We almost lost you there. How are you?
Okay, let me mute you. I'm a first-time caller, and I'm calling regarding insomnia, which I've had for many years, and I even spent the night in a sleep lab, and it came back to having poor quality sleep. And I've tried all sorts of drugs, and the drugs make my mouth very dry, which even makes it harder to sleep. I have a problem falling asleep, not staying asleep.
So what's your question?
Well, my question is, how do you treat this if you have it's a chronic condition, and I was just wondering, how do you treat this condition
All right,
safely?
we got the man here. We got the man to answer this question, Dr. Lombardo.
Hi, Naomi.
Hi.
You mentioned chronic, so that's key when it comes to insomnia.
Yeah.
It is the most difficult insomnia to help, but that doesn't mean there's not help there for you.
Right.
But it is one that gets ingrained.
Right. You fear it. You associate going to bed with anxiety and
Yes.
and the whole thing. Now, I just want to say that I'm being treated right now with a drug called Klonopin,
Yes.
which is the first drug that has worked, believe it or not.
Yeah.
But I know it's a barbiturate, and my doctor says eventually she'd like me to go on Neurontin, because
Yeah.
it's not as bad as Klonopin. Do you know anything about Neurontin?
Well, I can tell you Klonopin is a benzodiazepine. It's in the family of the Valium-like drugs.
Right.
And it does work. It's a long-acting drug, so it can help all day and even into the night. It doesn't work just for a short period of time. So that is a very effective drug in some cases where the insomnia is related to anxiety, and anxiety, as you mentioned, can keep one awake and prevent the ability to get to sleep.
Right.
Neurontin is more in the family of a neurologic. It's working on the nervous system and helping to quiet the nervous system. And if you can take the Neurontin, you might be better off because the benzodiazepine, as you know, is addictive. So you can become dependent.
Right.
And that's less of a problem, certainly, with the Neurontin. So I would encourage you to follow your doctor's advice.
Right. Although the sleep doctor is keeping me on Klonopin because I just started. And I'm on the minor, the smallest dose possible.
Thanks, Naomi. Interesting question. In this sleep, did they give you pillow? Like, can you give? I want down feathers or polyester to make it comfortable, or you get what you get?
Yeah, you're talking about at the sleep when you have the sleep
when
test
you go into
done?
the sleep, yeah.
Oh, it has to be ultimate comfort. Sure, the best
Single or
pillow,
double
the
bed?
best queen size.
All right, no, but we wish you well.
Well, thank you, doctor.
Good luck
Where are
to
you
you.
calling us from, Naomi?
Jackson Heights.
Oh, it's good to have you on board. Call us
thank
back.
you.
Take care. We're going to have now Brenda, who may know the answer to the quiz. Hi, Brenda.
Hi.
Where are you calling us from? You have a very soothing voice, Brenda.
Oh, thank you.
I like that. Where are you calling us from?
Brooklyn,
Which part?
downtown, Livingston Street.
Oh, the nice area down there. We always like that place.
Yeah, I'm 40 years in this apartment.
You like the Queen restaurant?
Queen?
Yeah, it's over on Court Street, and I think it's just a block away from Livingston and Court.
I used to sell on Livingston, on Court Street and around Livingston, between Fulton and Livingston, but I don't remember that restaurant.
It's a great. I met Dr. Lombardo and his wife, who says that's her favorite restaurant.
We were there 2 days ago celebrating the birthday of 2 of our sons. Great place.
You got to.
It's a great area over there.
Yeah.
Great.
But anyway, let's get down to serious business here. Now, let me repeat the quiz, because they say you may have the answer. Which TV teacher is the only person to have won an Emmy for a religious program? And what are you saying?
I'd say the key word is only. That's why right away I thought of Bishop Fulton J. Sheen.
Okay, let's go to our judges. Could it be Bishop Fulton J. Sheen? Wow, Brenda, how'd you get that? It's amazing.
I'm 70 years old. I know everything.
You know, he was the Archbishop, the Auxiliary Bishop of the Diocese of New York. And his show, remember what night it was on?
No.
No, he's on Tuesday night at 8 o'clock, exactly like this show. And they called it the Graveyard Shift because he was up against Milton Berle and Frank Sinatra and managed to do well, just as we were up against American Idol and the X Factor. I see similarities.
Yes, I loved that man. I loved him.
He was was an unusual person. Believed in this teaching. Was on the radio for 20 years, then another 15 years on TV, and he's now up for sainthood. So it should be very interesting to see what happens. He's buried in St. Patrick's Cathedral. So anyway, so what are you going to do with your plaque? Where are you going to hang it?
Probably in the bathroom where I can look
goes
at
in the
it
bathroom.
every day.
But Dr. Gigerich, he doesn't know we have a handmade plaque from Japan. No, we didn't spare any expense. We send it out, and they're going to get that. And a lot of people put it in the bedroom, the living room. But where are you going to put it?
In the bathroom.
Bathroom. All right, it's good. It's good to. But anyway, we hope you enjoy it. It should be there in a couple of weeks. You should have it.
Thank you.
Okay. And any medical questions, or just the answer to the quiz?
Well, I have medical questions. I can't think of them right now, but I'm troubled about something I read a while back about the children with the cleft faces.
Yes.
I read in a free health paper that they get that from prenatal medication. And it's in a certain area. The doctors give the mothers that, and then the children are born like that. And I'm wondering why doesn't the medical industry deal with that.
All right, we're going to
Good.
take a stab at that question. Listen to the answer. You know, and again, not taking medication and vitamins is a cause for this cleft palate. Is anybody aware of medications that they're being given? No. So we know, though, you got to take those prenatal vitamins, the vitamin B and the folic acid, very important for this. But Brenda, thanks a lot. You're a winner. And we're now going to go to Jane. Jane? Is it Jane or John?
Hello,
Yeah, who is this, please?
Joan,
Joan, how are you? It was close. Jane, John, Joan. Where are you calling us from?
Bay Ridge.
Bay Ridge, Brooklyn. And where do you like to eat out there?
Oh, just about every place.
You know, I was in the other place, Ario. I was in there last week.
Uh-huh.
What do you think about that place?
I'm not that crazy about it.
No, what? Yeah, it was nice. Very bustling, crowded place, a lot of noise.
Yeah, well, yes, very noisy.
And that birthday, when they sing the birthday song, huh? Yeah. So where do you like to eat? Tuscany Grill?
Tuscany Grill. I even like New Corners. That's been around Bay Ridge for about 75 years.
We have to try that place. I've heard a lot of good things in the last couple of weeks.
And it's easy to park there.
All right, we're going to try that. So, Joan, what can we do for you?
I want to ask the orthopedic doctor about glucosamine and chondroitin.
Oh, good. Dr.
Sure.
Manning.
What's your specific question?
I've been taking it for 2 tablets a day for about 5 years, and I think it's helped me a lot. And a friend of mine just told me, her orthopedic doctor told her, you can only take it for about 3 months, and you have to stop it for a couple of months and then resume it.
I haven't heard that, but if it works for you and you feel you're getting good results, continue taking it.
There's
Definitely.
no problem taking it every day and
Not that I'm aware of.
and not stopping it.
Not that I'm aware of.
Okay, thank you very much.
Very good.
Okay.
Thanks for the question. I got to ask Dr. Gingrich while I have him here.
Yes.
You know, let's say I'm in the 70s, 80 years old. I'm slowing down. I feel a little dry skin. How do I know if it's from thyroid disease or is it just from getting older?
The most important thing is to have a blood test done. Very simple blood test, something called a TSH, and we can tell whether that is from underactive thyroid.
So can you tell me like 3 things to look for if I have underactive thyroid? What would lead me to believe something was wrong?
The very common symptoms: fatigue, dry skin, as you said, and weight gain.
So anybody out there with those problems, you want to get into your doctor, make sure you get the blood test drawn and see, because a lot of times it can be missed, right?
Absolutely.
And
It's more common as you get older.
So we're going to take a short break now, and I want to just talk to you about the Net Viewers survey before we take that, because it's very important. Just take a few minutes to send it out. You can either get it online, you can get it as you're waiting to come on to talk to us on the show, or you can mail to NET, N-E-T. And that address, let me give it to you, it's 1712 10th Avenue, Brooklyn, New York, 11215, and ask for the survey to be mailed to you. Of course, again, you can participate online. Very important to do that because this is what the management is looking for. So tonight's topics are endocrinology, orthopedic and sleep medicine, and you got everything right there. So we'll be right back. Don't go too far.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are endocrinology, orthopedics, and sleep medicine, where we have Dr. Edmund Gingrich, Dr. Reginald Manning, and Dr. Gerard Lombardo. Now let's get right to the questions. We have Jerry on line 1. Hi, Jerry.
Hi, Dr. Garner.
People were commenting on the spelling of your name. It's G-E-R-I?
No, it's Gerry.
Oh, okay. They were commenting on the wrong, on G-E-R-I.
That's short for Geraldine.
Very nice. And where are you calling us from?
Bensonhurst.
Yeah, we love that area out there, especially the Eden. That's the Tomasos we like very much.
Oh, I've never been there.
Oh, and the guy sings a little opera. Have you been in there, Jerry?
I have done recently.
I've been there many times. It's a great place.
Yeah, I think you'll enjoy that.
Well, I'll see if we can get there someday.
Yeah, what can I do for you?
Okay, my problem is I don't know who's going to answer my question. I'm a diabetic. I go to endocrinology. I have an orthopedic problem. I'm a cardiac patient, And I also see Dr. Lombardo, by the way, for my sleep apnea.
Excellent. So let's start with diabetes, then go to orthopedics, then to sleep medicine.
Okay, diabetes. I have. I'm on metformin, 1,000 milligrams twice a day, and glipramide. I'm on that 4 milligrams a day. I was on insulin, and I was taken off because my A1C was 5.5. It went down from 10. Now, the thing is this. If it goes up at any point, do I have to go back on insulin?
Okay, Dr. Gigrich.
That's a very difficult question. It sounds like you're doing great. You must have improved your diet also. I would think that that's very important. We have other new medicines that we can add. It doesn't necessarily have to be insulin. You know, one of the nice things over the last 5 to 6 years, we've had really an explosion of new medicines. And so you might want to discuss those with your doctor. But right now, the most important thing is that your A1C is terrific. That's an excellent number.
Thank you.
Very good. Now, what about orthopedics?
Okay, orthopedic, I have a torn rotator cuff, and I also have frozen shoulder in the same arm. Now, the thing was, I was going for shots, and the shots worked for a while, and they no longer worked. I was told the only thing is now to do a surgery. But that takes a 4-month recovery, and, you know, I'm diabetic. I figured it's going to take longer. Now, the other thing is, being that I have sleep apnea, and I'm also a coronary artery disease, I was just wondering if it's safe for me to go under a surgery for an hour and a half to 2 hours under a general anesthesia.
That would have to be evaluated by pre-op testing, but the other option is to have it under regional anesthesia. A lot of shoulder surgeries they do under blocks now, where they block the nerves that supply the shoulder, and you're actually awake during the procedure. So that's another option.
My doctor said that he wouldn't do it, you know, other than putting me out.
Well, they have to be able to give you general just in case the block doesn't work, but the block might be the first option for you, the best option for you.
I see. Because I was just wondering, being that I have the sleep apnea and I also have the problem with the coronary artery, I have 2 stents.
Understood.
You know, I might not be able to do it.
You'd have to have the evaluation and determine if you're a good candidate or not.
I understand. And how are you, Dr. Lombardo?
Thanks for asking, Geraldine. I'm well, thank you.
Can we just ask Dr. Lombardo to tell us what sleep apnea is?
Well, sleep apnea is when the back of the throat closes during sleep, resulting in a drop of oxygen and a stress of the entire body. And as I'm listening to you, Geraldine, diabetes and even pain syndromes might improve if you have good sleep. That's been shown. So it may be no surprise, certainly not to me, that your diabetes is under better control because we have the apnea under control.
But I mean, I use my machine at night. I
hope you do. Yes, Geraldine has a CPAP.
Right.
And it helps open up that blockage that we talked about.
Interesting. No. And it's possible to sleep with that. It looks a little bit awkward, but it's okay.
No, I don't have. I have what they call the nasal pillow.
Oh.
Which is fantastic, because I mean, I had gone to Dr. Lombardo and I told him I couldn't use the one that goes right over the nose. I felt like I was being suffocated.
Does that cut down on the romance?
Is what?
The romance. The romance. Sleep. I don't know. You should write that book, CPAP and
no,
and
I should write about all my problems.
Oh. Okay. Anyway, thanks for the call.
Thank you very much. And I'd like to tell one thing. Your panel is great.
Oh, thanks a lot. It's a great panel tonight. Thanks a lot.
Thank you.
Thank you.
Okay, let's go to Anthony. Hi, Anthony.
Hi, Dr. Gordon. How are you?
How you doing?
I'm okay. Yourself?
Where you calling us from?
Middle Village, Queens.
Middle Village. How are things out there tonight?
Everything is great.
What's your recommendation to eat out there?
London Lenny's.
We always like that place. Reasonably priced, good fresh fish.
Yes.
Very
Couple
good.
blocks from me. I'm right there, very close.
So what can we do for you tonight?
As of late, my wife is mentioning to me I have a terrible snoring problem. And other than I have high blood pressure, that's the only illness I have.
Okay, snoring.
Yeah.
And high blood pressure.
There's another link there. Maybe you just heard the previous caller talk about diabetes, but there is a link to hypertension as well. So untreated apnea, again, if you have apnea, and I should share with you so you're not panicked that 40% of the population snore, but the incidence of sleep apnea, the thing we're speaking to, is roughly 10%. So just because you snore does not mean you have sleep apnea. But it is something that you should definitely mention to your doctor, because a test, a sleep study, can help determine whether you're just in the category of snoring or this more serious apnea syndrome.
Okay, is there any other recommendations as maybe to cut it down a little bit?
Well, you're speaking of snoring?
Yes.
Yeah, but consider that the rattle in the rattlesnake. It could be very dangerous. It could be a sign of the more serious sleep apnea. So again, before we get on to talk about the different treatments for snoring, you should have that sleep study done.
Okay, great.
Good stuff.
Thank you so much.
Thanks a lot.
Be well.
Take care. I'm going to go to an email question now. I had a knee replacement 5 months ago. The knee is healing, but I have a lot of inflammation on the inner part of my knee. I went to my doctor and he said it was my tendons. He gave me Voltaren cream to apply to my knee. Is that Voltaren cream or Voltaren cream?
Probably Voltaren.
Okay, I went back to him and he wanted to give me a cortisone shot, but said I had a chance of infection in my knee if he did that. So I didn't take the shot, but is it advisable to have a cortisone shot after knee replacement? And yes, I did a lot of therapy. Terry.
That's an option. The other option I would consider is oral anti-inflammatory medicines. You have a number of them called nonsteroidals, which are safer, obviously, in terms of your infection risk. But if you do it under sterile technique, the risk of infection is very, very low. So again, you might try the oral medicines first, and if they don't work, then I might go to the cortisone injection.
Do you see this a lot after people?
Not too often, thank God. But you see the inflammation, and often it responds to oral anti-inflammatories, which I'll start fairly early if they're very swollen and red.
So Terry, we're going to take one more call. We're going to squeeze in before we go to the break. We're going to go to Iris. Hi, Iris.
Hi, good evening. Tonight. Yes. Hi, how are you?
Where are you calling us from, Iris?
I'm calling from Brooklyn.
Brooklyn. I detect a little
Midwood,
accent.
Brooklyn.
Yeah, where are you calling from? I mean, I hear that little accent there. Where are you from?
I am from Puerto Rico.
Oh, it's nice. I was just talking to someone that got back. Said it was beautiful weather last week. Was at the El San Juan Hotel. I was eating in the Blue Ribbon Sushi, and the waitress just had gone over there. It's a beautiful island, right?
It's a beautiful island.
What's your favorite part on the island?
Oh, the beach.
The fish.
The beach.
The beach.
The beach. I like the fish too. There's some.
I like the fish too.
Yeah, there's some great fish restaurants right on the beach there. Anyway, it's good to have you back. What can we do for you?
Well, my husband has diabetes too.
Type 2 diabetes.
Yeah, but he's supposed to have insulin, and he does not do it. I made an appointment already again to the doctor, but I'm concerned because I saw in his skin like little fat, red spot, and also in his elbow.
I want you to speak up a little bit. Go a little closer to the phone so we can hear.
Okay, I'm sorry.
Okay, we're ready.
Okay, he has diabetes too, and he doesn't want to go to the doctor, and he doesn't want to use the insulin.
Okay, so what do we have? A compliance problem. How old is he?
He is 49.
Is he overweight? Iris? Well, maybe she'll come back in the middle. But what's the story here?
Oh, men are the worst patients. This is my opinion. I don't know if my colleagues think the same. But, you know, I think there's a lot of options now. And it's very hard to say that insulin is the only choice. We have many new medications. I think the first thing is getting him to come to the doctor, talk about lifestyle, making sure that we're eating properly, and also to take a chance at some of the newer medicines might be the option here. Insulin often is used, but we tend to try the other oral medications first.
Okay, so I hope that helped, Iris. And what we're going to do, we're going to take a little break now. We may be having some trouble with the phone line, so keep calling in. We're going to take a short break, and when we come back, we're going to go to your questions where the topics are endocrinology, orthopedic, and sleep medicine. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are endocrinology, orthopedics, and sleep medicine. Now let's go to some more questions. And I have a question. I want to ask Dr. Lombardo. I've heard an association of people who work nights, like nurses, interns, and so on, gaining weight due to poor sleep. I don't know if it's related. Is it a coincidence? Or is something that you could blame your job on?
Well, actually, shift workers make up about 30%, 25–30% of our population. And they do pay a price for that. And often that's why the pay is a little bit higher. At least that's what's said. It impacts on sleep. It does, and anything that impacts on sleep can affect weight. We know that. This has been clearly shown that poor sleep promotes weight gain.
How does it do that?
The centers for sleep, as it turns out, and hunger are very close in the brain. And it's thought that there's some interplay of the different hormones and nervous connections. And we've had the experience, those of us who've had jet travel, once you cross time zones and experience jet lag, the first organ system to be affected is the GI tract, followed almost immediately by sleep in terms of our functioning, so that these centers are very closely tied together. That is, the ability to feel satiated, satisfied from food and sleep, very close to each other in the brain.
We've been getting some, I know the person next to Monsignor actually has been asking a little bit about diabetes, wants to know how much of diabetes could be cut out with diet. Is that possible, or do you have to go on medication?
Well, lifestyle and sometimes just a 10-pound weight loss is very effective and in the early stages of diabetes. However, over time, we tend to have to add medication to
it seems like if you have that tendency, you're going to end up on.
Absolutely. But lifestyle is very important. Good exercise and really limiting total amount of calories and watching the starch.
So, and it's not the worst thing, though, to be on the medication, right? These new medications?
No, there are many new medications. They can be very safely given. Most people respond very well. And because we have so many more options now, we can tailor-make a program for people.
Very nice. And Reggie, do you see people with diabetes coming in with problems that your other patients don't have with the knees and with the
I think they tend to be a little heavier very often, which increases your chance of getting arthritis of your weight-bearing joints, your knees and your hips and your lower spine. So definitely the weight is a factor.
What about diabetic ulcers and stuff? You see that?
No, thank God.
No.
Usually they're around the feet, and podiatrists tend to take care of those. I think they do a fair amount of dressing changes, whirlpool therapy, things I'm not interested in having experience.
But I noticed the hospital purchased HBO, a hyperbaric oxygen.
Right.
Do you find that's useful?
It is useful for more chronic, non-healing ulcers. But the important thing, and this is one of the important things I think people with diabetes, particularly when they start to lose some sensation in their feet, and their doctors tell them this, they should really be inspecting their feet, because a little pebble, a little stone in the shoe can wind up causing an ulcer. So people have to learn how to inspect their own feet.
Very good. Let's go to Steve on line 1. Hi, Steve.
Hello.
Hi, Steve. Where are you calling us from?
Brooklyn.
Brooklyn. Which neighborhood?
Crown Heights.
Crown Heights. Again, not much out there in the way of food. We've been looking for good restaurants out there. Anything on the horizon?
Actually, I'm by the Botanical Gardens. I usually go to. I don't eat out too regular. Put it that way.
That is a nice place to eat. The Botanic Gardens has a nice, during the summer it's outdoors, then it goes indoors, right?
Yeah.
Really nice. So what can we do for you? Steve?
I do not sleep at night. I cannot sleep. I've had the problem all my life.
Sounds like, you get despair when you can't sleep. So what your question to Dr. Lombardo?
What can I use? Currently, I'm using Zolpidem, 10 milligrams.
Yeah, so
I would use it, I get it from my doctor. I might use it a couple nights, and then I would get off it.
Yeah.
But I'm concerned.
Sure. Well, Steve, are you a shift worker by any chance?
No, I'm 67 years old and retired.
Oh, you sound like a young man on the phone.
Young. Good voice.
So,
thank you.
Yeah, perhaps you heard one of the previous callers, chronic insomnia, which you've described. You said, I've had it all my life. That's a tough one to treat, and often it's not just with medication. There's something called cognitive behavioral therapy. And that kind of therapy looks at the approach to sleep in terms of what you expect from it, in terms of what you hope to feel like the next day. So there are rules to follow, things like caffeine, and of course not smoking before bed, getting exercise. These are very basic things that help. And something that I really focus on is routine. And that is if you allow yourself the opportunity to relax prior to sleep, whether it be praying or reading or just closing your eyes and listening to some music, it gets your nervous system more prone and more accepted to the wave of sleep that is very natural. You just have to find it. So these cognitive programs can help, and you should talk with your doctor about supplementing some of these with the medication in the hopes to one day come off the medication.
Steve, what do you do when you can't sleep? Do you watch TV?
I watch TV.
What do you like to watch? What's on at like 2 in the morning, 3 in the morning?
Anything religious. I watch religious programs.
You know, our show is rerun at like 2 in the morning. I don't know if that may help you. Steve?
I'll try watching it.
Okay. All right, so it's nice to hear from you.
Thank you.
Give us a call back as to your progress, okay?
Thank you, kindly.
Okay, now I think we have one of the listeners who's the furthest from this area, all the way up in Rockland County, Larry. Hello, Larry?
Yes.
Is this the Larry from Rockland County?
No.
Oh, I was wrong on that one. But anyway, where are you calling us from?
I'm calling you from Bensonhurst.
Another Bensonhurst caller. You've been into Tommaso's, haven't you?
Yes, of course, yes.
Isn't that it's a nice place?
Very nice.
Is the man still singing there?
Yeah, all the time.
He's singing all the time. He's a very happy man. Yeah, it's good. But what can we do for you tonight?
Okay, my question is that I was recently diagnosed with diabetes 2, and my vision seems to be changing, number one. And I want to know what you think of two drugs, saxagliptin and metformin.
And Larry, I just want to ask 2 questions. How old are you?
56.
And how tall and how much do you weigh?
I'm 6'2", 260 pounds.
260. Okay, first of all, I'm going to ask Dr. Gigerich, we keep hearing type 1, type 2. Just give a quick rundown of the difference.
Type 1 is absolutely insulin requiring. Generally, we see people with type 1 have development of diabetes either in adolescence or as young adults. And then type 2 is much more common. And actually, it's becoming more common in children because of the obesity epidemic. And this problem is a little different. In the beginning, you have insulin, but your body's resistant to the action of insulin. So a lot of the medicines, and some of the medicines this gentleman just mentioned, are used to help your body use the normal amount of insulin that it can produce. Later on, sometimes patients then will require insulin because their body's not able to produce enough insulin. So you mentioned that your vision is changing. Have you been testing your blood sugar?
Well, like I said, I was recently diagnosed, and I started out with 330, and now I'm down to 270, and I'm sure it's much lower because I cut out sweets and soda.
Well, as the blood sugar is elevated, and then when it starts to come down, you may anticipate that your vision will change a bit. You should go and see an ophthalmologist. It's very important when people who have first diagnosed with diabetes go see an ophthalmologist to make sure there's no damage on the back of your eye. You mentioned 2 medicines. Actually, the first medicine we like to use with people is metformin. It's relatively inexpensive and very effective. It helps with the insulin resistance. So that's often a first-line drug. These are things that you really need to discuss with your doctor. When people are first seen and the blood sugars are that high in the 200, 300s, we really want to make sure that you're eating properly, that you avoid sodas and juices. I really like people to watch very carefully with their diet, and you may need medicine. You may need more than one medicine in the beginning, and I think once you get on a good program, you monitor your sugar, learn how to eat properly, you'll probably get in good control very quickly.
Thanks, Larry, for the call.
Thank you. Can I ask one other question?
We got the busy lines. All right, quick question.
Yeah. What about diet sodas and like saccharin and things like that? Is that okay to take?
We generally think it's fine. It's better to be drinking diet soda than regular soda. Regular soda is not good at this point.
Thanks, Larry.
Oh, thank you, and great show.
Good luck. Good luck. I see we have Roseanne waiting patiently. Hi, Roseanne.
Hi.
How are you doing tonight?
I'm doing good, thank you.
You're not into talking tonight too much?
No, I'm a little bit unhappy, but
what's up?
I saw your program, so I had to call in for the
What happened?
I found out that I have hyperprolactinemia and
Hyperprolactinemia. You having milk? Is milk coming from the breast?
not currently because I went to see an endocrinologist, but I still don't understand why does it happen. And I am currently taking carbagoline.
Okay, you know what I want to do is I want to ask, because I want to make sure we get enough time to answer it, I want to ask Dr. Gigerich to tell us what hyperprolactinemia is, and so people out in the audience would understand it, and then some of the possible causes.
As Dr. Garner was mentioning, prolactin is a hormone produced in the pituitary gland that helps women be able to breastfeed. It helps milk production in the breast. So sometimes the prolactin can be elevated. You can have milk in the breast as a first sign, or loss of menstrual periods. So the evaluation, I don't know if you were taking any other medication, but we like to look at a complete medication list because there are many medications that can cause prolactin to be elevated. But most importantly, we do either a CAT scan or an MRI looking at the pituitary gland, which is up here, and to see if there's a small growth, a pituitary tumor. And it's very easily treated with cabergoline. I think that's the drug that you're taking.
So we hope that that helps you. Again, it shouldn't be life-threatening.
No, it's not life-threatening.
Does that help you? We're glad. Okay.
I just wanted to ask if I become pregnant, how does hyperprolactin and infertility, how does that affect?
Can she become pregnant?
Right. If you have what we call a microtumor, you become pregnant, you would come off the medication and your doctor would watch you closely. If you have a large tumor, and again, this is where you have to really speak with your doctor, we often will continue the medication during pregnancy. And it's relatively safe.
Okay?
Okay, thank you so much.
Okay, I'm glad. You feel better. It sounds like things are looking up. We're going to go to email question number 2 because I think we lost Dana for a minute. Dana, if you're there, call us back because we're having a little trouble with that line. But hi, she says, hi doctor, this is Cece from Jamaica. How beneficial is swim therapy for arthritis?
Generally, if it's a lower body joint like a hip or a knee, you do very well in the water. You want to try to avoid impact activities. That increases the wear and tear across the joints. But sometimes it can aggravate the shoulder because you may not have the range of motion for that. So it really depends on the joint, but generally water therapy is very good for arthritis.
All right, I don't want to lose Dana. We got to have her back. Hi, Dana. Donna.
Yes, Donna.
We almost lost you. I'm glad we have you here.
Yes, I'm glad to be on. Thank you.
Where are you calling us from, Donna?
I'm calling from Brooklyn.
Which part?
Bed-Stuy.
Bed-Stuy. Again, no restaurants there, huh?
Oh, no, you've got to come to Peaches.
Peaches?
Yes.
Where is it located?
Lewis Avenue off Decatur.
On Lewis Avenue.
I've been there.
Dr. Manning knows the place well. What do you say?
Yes.
What do you give it in this got? 25, 24?
Yeah, it was okay.
Okay, well, that's good. That's good.
All right.
I do know Dr. Manning. Dr. Manning I knew from childhood from Siloam Presbyterian Church.
Oh, boy, that's a way back.
Yeah.
That is a way back.
Give us some insight into Dr. Manning as a child. How was he?
Oh, a wonderful, wonderful young man.
I'll pay you later. Thank you.
No, we always get personal calls. We always get people that know. Dr. Manning is well known here, but he's a great guy and a great doctor.
And he did perform orthoscopic surgery on my left knee a few years ago, and I'm not having any problem with
Oh.
it.
He's very much relieved.
Yes. I am calling about the right knee. I recently, excuse me, I'm getting over laryngitis. I recently had an MRI which shows that I have a stress fracture, and I was wondering if having a stress fracture automatically means that I need to have knee replacement surgery.
No, stress fractures usually are just microscopic fractures of the bone where the whole cortex or the outer lining is intact, and generally they heal very, very well if you allow them to heal. We do knee replacements for arthritis, so if you have bad arthritis in the knee, particularly with a deformity, if it's knocked too much or bowed too much, that's when might be the indication for a knee replacement.
I see.
So you're going to see Dr. Mann for the right knee?
I
Dr.
most
Mann?
definitely am.
Excellent. That's
I'll
the
be
right
there.
guy to go to.
Thank you.
So thanks for the call, and maybe we'll see you out there. What's the name of that place?
Peaches.
Peaches. All right, take care. We're going to get, the show's just about done, but I want to just I like to get a last few words, some words of wisdom from each of our doctors on, 1 minute on how people can be healthier. So let's start with Dr. Lombardo. What do you suggest?
Well, there are 3 things that we can focus on to stay healthy. And we talked about one of them. Sleep is essential to be in good health. Your diet and exercise. So actually we're covering all 3 areas with our panel
Took 2 from me.
Yeah.
It keeps your diabetes potential a little bit lower and protects your joints and keeps them flexible and strong.
All right, and Dr.
I would agree with my colleagues, but I also think we all need to find a way to relax. In addition.
What's the greatest advance in medicine in the last 50 years?
Jack Daniels.
Jack Daniels, I heard.
Greatest advance.
I don't know. What do you think, Jerry?
Well, again, I'm biased. REM sleep, dream sleep was discovered in '53. So that's
up
within
until
that
that time,
range.
people didn't know?
Didn't know what dream sleep was, what REM was. Rapid eye movement sleep was described in the 50s.
I just got to ask one question. Everyone dreams in black and white or color? What is this? Is that a myth or?
No, there are some that have vivid color dreams, and then those who are jealous that they don't.
Well, the hour flew by, and I hope that the audience I appreciated having you here.
Thank you.
And,
Thank you very
that's
much.
it for this episode of Ask the Doctor, where I'd like to thank Dr. Edmund Gigerich, Reginald Manning, and Dr. Gerard Lombardo for coming in. We hope we've been able to help you. It is good to remember that you should be proactive about your own health. Speak to your doctors about your concerns. Go for second and third opinions. And before we get to next week's show, I want to remind you once again about the survey, to fill that out, because the other shows are filling it out. So we want to see Ask the Doctor get high grades. So if you're out there, send it in. What are you going to say, Reggie? You're sending your survey in?
Yeah, I'll send my survey in, promise.
Very good. So next week we're going to discuss geriatric medicine, so that's for older people over 65, cardiology, and breast disease. Now I want you to visit our website at netny.net/askthedoctor. Here you can read the weekly tablet column, podcast, the forum. You can email your questions in advance. And again, participate in our viewer survey. And I want to thank those who've already participated. Thank you especially to Dr. Linda Lapatosa, our quizmaster. It was a good question today, the
Absolutely.
push machine. And remember now, here's a tidbit. Tune in at 10 o'clock tonight for the encore presentation of last week's show. So you can see it was a great show last week. So you want to watch that again, 10 o'clock, you want to see it for the first time. Hope Steve will be watching it sometime at 2 in the morning. Goodbye, and I'll see you on the tablet.